What a great panel to be followed by as we talk about making it happen and partnerships. The momentum on the health workforce agenda is unlike ever seen before, right? Can I get another round of applause for that? So how do we take this momentum that we're seeing for supporting health workers, listening to them, supporting them, applauding them, and turning it into action? This conversation that we're going to kick off is about how we take all this momentum, turn it into action, and that is why all of us are here today, why we are having these conversations. And the exciting thing is that there's actually investments and action taking place. So I'm going to be turning it to our esteemed panelists here to talk about partnerships. How are they making partnerships work? Partnerships between governments. So very appreciate the Honorable Minister for being with us here today. How do we make partnerships between multilaterals and international NGOs and civil societies and health workers themselves? And of course, as I am speaking here and as a moderator, I have to say that gender is cross-cutting. We have to recognize that these partnerships need to be based on principles of equity. Women are majority of the health workforce, and we're talking about decent jobs for all health workers. So on that note, I'm really excited to introduce our panel. I asked them to really talk to us candidly because it is very exciting to see this momentum. It's exciting to see all of you invest your time and resources and share with us the lessons of how we make meaningful partnerships and how do we learn from the pandemic so we can truly take the actions and support our health workers. So we are joined today by the Honorable Ummy Mwalimu, Minister of Health, Tanzania. We're also joined by, trying to make sure, Thomas Opiyo, great, perfect, Living Goods Country Director. And we're also joined by Emma France, a Mothers to Mothers Global Development and Strategic Engagement Director. And we also have Lauren Moore, the Vice President of Global Community Impact, Johnson & Johnson. So I'd like to first turn to our Honorable Minister and ask what has been a game changer for Tanzania when it comes to strengthening your health workforce. And again, thank you for prioritizing this conversation today.
Thank you very much. Good afternoon. First of all, let me thank the organizers of this meeting for inviting Tanzania to be part of this important meeting on human resource for health. Like in every country, human resource for health is a cornerstone of the health system in Tanzania, and it plays a critical role in achieving universal health coverage. A bit of the background, Tanzania human resource for health is actually facing a shortage of about 48%, 52% actually right now. And with rural and hard-to-reach areas being more severely hit. And another important point to share with the participants, Tanzania has more health professionals graduated in the labor market than the health system capacity to absorb. So we produce more nurses, clinicians, laboratory scientists, but because of the wage bill, we cannot absorb the health professionals, especially in some cadres. However, because of these challenges, we have developed our human resource for health strategic plan for 5 years, 2020 to 2025, which is calling for more collaborative efforts to address human resource shortage crisis in the country. But our human resource for health strategic plan, it does also set out a framework for the coordination and development of innovative and reflective interventions that are considered to bring positive impact on human resource for health. Now back to your question, what partnership models have worked to bring positive attitude to the health workforce? For us, we are basically using a multi-sectoral models such as sector-wide approach, SWAP in the health sector. Through SWAP, the Ministry of Health has established partnership within the government So within the government, we are basically working with ministries, departments, and agencies, as well as development partners, non-governmental organizations, private sector, faith-based organizations, to facilitate implementation of this health sector strategic plan. For example, through government ministries, departments, and agencies, we are collaborating with the President Office, which is responsible with public service management, as well as Ministry of Finance, to discuss domestic financing and efficient allocation of human resource for health. So we have actually monthly and quarterly meeting with the government ministries responsible, or which are very much linked with human resource for health. We are also collaborating with development partners who are supporting the health sector to discuss domestic financing and efficient allocation of human resource for health. And for the development partners in the health sector, we are working with them to mobilize the external financing to reach out to targets set out in our human resource for health strategic plan. Another model or approach which we are using also through SWAP is the public-private partnership, whereby we are working with the private sector, faith-based organizations. For example, we have service agreements with more than 300 faith-based organizations and private sector facilities, whereby more than 6,000 healthcare workers have been actually, who are on the payroll of the government, but they are working with the private sector on placement contracts. And maybe just to conclude before going too far, we are also working with non-state actors such as Benjamin Mkapa Foundation and Umbrella Africa through the support of the Global Health Initiative. And I would like me to acknowledge the support of the Global Fund and PEPFAR. So we have managed to facilitate fast tracking placement of health workers, especially in hard-to-reach areas. And the partnership with the Global Health Initiative, for example, has actually enabled short-term deployment of more than 10,000 skilled healthcare workers in Tanzania and 15,000 community health workers over the last 5 years. So thank you very much. So at least for us, we believe through sector-wide approach, then it is very possible to bring positive attitude to the healthcare workforce in Tanzania. Thank you.
Round of applause for the minister. Minister, as you answer that question, it was partnerships all across. You know, I was going to ask you, what does it take? I mean, what I see is that first of all, you have a plan, you have a strategy. You also mentioned that it is sector-wide, so that there truly is a whole of government communication happening across, and not just the Ministry of Health, but you're talking to your fellow ministers from different backgrounds. And that also these partnerships aren't just limited to the government. It is public-private. And then you also went on to talk about how these partnerships are engaging civil society organizations as well. And that's a lot of organizations, a lot of people to coordinate, a lot of meetings. How do you make progress? If you had to pick one key ingredient, you know, for those that are tuning in, we love to work in partnerships, but we know there are challenges as well. What has really worked in Tanzania if you had to pick one thing?
Of course, we have learned our lessons that through a number of the diversified factors that complement each other. As I have mentioned earlier, we have one policy on human resource for health in Tanzania and one strategy that guides all human resource for health stakeholders on key investment areas. So it is not too much work in Tanzania because in our discussion, in our planning process, monitoring, and accountability process, we are basically relying on this one plan, one budget, one strategic plan to address the human resource for health challenges or crisis. I don't want to call crisis, challenges in Tanzania. But also, we have also strategic forums at policy and technical levels within the government and the stakeholders that also review progress implementation on human rights resource for health. But we have also developed the monitoring and evaluation framework and mapping actually of resources required for each on key human resource for health intervention. So we believe one plan, one budget, one monitoring, and resource mapping has been very useful for us to coordinate partners to address human resource challenges in Tanzania.
Fantastic. Well, take that message home. We need to have a united plan, something to really coordinate across the board and have budget. So we'll be coming back to you, Minister, to hear more about the lessons learned and success in Tanzania as you still continue to face challenges. I'd like to turn next to our partner, Thomas from Living Goods. So Thomas, Living Goods has been a close partner of the government of Kenya for at least 8 years. How have you been able to support the government to scale and address its health workforce challenges?
Yeah, thank you. A beautiful question. Yeah, as really put it, we've been in Kenya for about 8 years, and I think working through different initiatives to really support government in its areas of needs. I think just a bit of perspective, Kenya as a country has a devolved structure of governance. So by that, then there's a national level where there's policy driven at that point, but then there's also the lower levels, which is the sub-national levels. We call them counties, there are 47 of them, where actual service delivery is happening. So what we've been able to do over the years really is work hand in hand at both levels, where we, at the national level, support in shaping what I call the enabling environment, policy, direction, costing and all those things, but also then bring it to life at the lower levels, which is the sub-national levels, where I call the pudding is actually being eaten. So we bring it to life so that people can see it. Now, yeah, I think also a bit of context around that is that over the last perhaps 5 years, there's been a strong momentum driven by the government itself towards achievement of universal health coverage, which of course in its sense also means different things to different people. But I think that has been what I would call ourselves lucky, being in that context, that with that political momentum, we started seeing a bit of what I call government putting skin in the game. So based on that, what we did was then to work a lot and catalyze that environment, but then moving into a bit of more what I call sustainable frameworks, but also innovative mechanisms working with government to meet its own needs. Where we are at, we've been able to demonstrate a lot of what I call strong service delivery, but there's an acronym, I won't do it justice before bringing it out, that to ensure that there's universal health coverage, there's a lot of focus on primary health care. And the key focus really was that you have fundamental functional community health working systems that then link into the primary, what I call the clinics, level 1, okay? So by that, what we've been doing and demonstrating is really that to ensure there's strong service delivery, there are 4 ingredients. And I think this is a part of the problem, or part of the opportunity, depending on how one looks at it in many contexts. That people talk about community health, okay, or the frontline health worker, but then there's one piece one piece of the component to try and drive it, then you don't achieve much. So what we've been able to demonstrate that you need actually 4 pieces of it. It is a 4-legged stool. We call it DESC. They're actually digitized, but also equipped, supervised, and compensated, okay, as critical components. And we're demonstrating that within what I call, initially what we call our own learning sites through donor money, but also showing government that this is possible, and slowly they're taking it up. So moving into UHC, post-2017, moving now, is then working with governments and trying to also ensure that they also have ownership into this and own and drive it. We co-create with them based on their contextual needs, but also put government at the forefront. So it's actually government-led. And I think we are getting very good results out of that. Now, moving forward beyond that, I think a key element I brought into that was around the digital landscape. And I think covered with the element that there was COVID. COVID, I think, was an accelerator in a way, okay? People saw there's a need for adoption of digital systems, not just for effective and more impactful responses, but also in terms of pandemic responses. So given that there's been a lot more government appetite adopting what I call frameworks which you've demonstrated into work, and it's actually led to a point where the government is thinking of actually made a commitment to adopt an electronic community health information system that can be adopted broadly across the whole country. Of course, so digital becomes a whole framework, but of course, I say digital in its own is nothing, so how do you bring in the other key elements? So that's where we are. I think it's fairly very exciting space. We are working towards it. We are a lead partner, but also amongst other partners in the space. And I think we're making great advances, but also there are challenges within which we can discuss as we move along. So that's where we are. Thank you. Yeah.
Thank you, Thomas. A round of applause for that amazing partnership example. I was going to ask you what are the ingredients to this pudding, but you answered the question. So, you pointed out community aspects, digital aspects, supervised, but you also talked about compensation. I want to pick up on that theme because that is something that has come up throughout the day about supporting our health workers means compensating them and compensating all of our health workers, especially community health workers as well. How has that gone? How is that conversation in the partnership that you have with the government going?
Yeah, I think it's one of those where I say we are progressing. I think, looking at it broadly, I think there's recognition across board that there needs to be compensation and better compensation as we move along. However, saying that way, there's going to be a continuum, because if you look at it, in terms of service delivery, the partnerships are actually happening at the subnational level. So the 47 counties could be at different levels of maturity, but I'll look for what I call an average one, okay? There's recognition, but there'll be budgets. And I think there are a bit of constraints on some of those places, okay? So where and what we actually do is really define what are prerequisites. So in part of it is also catalyzing, and it also goes into health financing, catalyzing domestic resources so that government can also start prioritizing part of this, because it's also easy to say there's no money, but I'm sure there's also a bit of what you're seeing is also that once there's prioritization, then the money can come, okay? It may not come at the right time, but there could be an element of it. So then in the journey, is the money there? Can we get the right amount? Progressively, can it come on regularly? Can it be brought on time? And also into the future, thinking of, can you also make it performance-based? So it's a whole 9 yards, but I think so far the signs are strong within the counties you're partnering with, that they're on that journey, and you work with them with a bit of flexibility, and actually there's continuous uptake of improvement, so it's good. Thank you.
Thank you, Thomas. And a reminder that, patience is required for partnerships to be successful, a work in progress. And hopefully we can take some of the momentum from neighboring countries. We heard from the Minister of Uganda earlier today of how they're compensating their community health workers. So hopefully this becomes region-wide as we turn to that. On that note, I would like to next turn to Emma France. Emma, we're so delighted to hear from your colleagues from Mothers to Mothers today. The power of partnerships, there's really an example of how there can be multi-stakeholder ambitions. And can you give an example of how partnerships are really working in the work that you do, especially giving us examples from the digital space?
Of course. Good afternoon, everybody. It's so lovely to be with you. So as you heard from Bupe, our model is really to employ and support local women living with HIV as community healthcare workers. And in the last 20 years, we have trained and critically employed and paid over 12,000 women who have reached over 14 million women in turn. And 1,800 women reach 1 million people each year in 10 countries. And that would be simply impossible without the power of partnership. I'm delighted to say that we partner with governments in every country we work in, and particularly honoured to be with the Minister today from the government of Tanzania. We work in partnership with the government there, providing technical assistance. Partnerships are the heartbeat of everything that we do at every level of the organisation, from the partnership that we have with frontline healthcare workers and the families we serve, as well as the partnerships we have with critical donors like Johnson & Johnson. I see my friend from LGT Venture Philanthropy in the audience. And those partnerships have enabled us to grow. I think when we think about successful partnerships, whether it's digital, whether it's anything else, we need to think about shared values. We need to think about ambitious aims, audacious aims. The sum has to be greater than the parts. We do need to think about multi-stakeholders. How can we convene the right partners together? How can we be prepared to listen to and influenced by the most critical voices? The most critical voices we heard, with due respect to all of our panels today, were the previous panel. How can we ensure that we are not making decisions without community healthcare workers for community healthcare workers? We need to be data-driven. We need to understand how we're moving the needle, and we need to be able to measure a few key indicators. I hope the donors are listening to us. A few key indicators that really help us move the needle. And partnerships need to be beyond the financial. It's so easy to think about partnerships as a transactional relationship. The good ones aren't. The relationships we've had with Johnson & Johnson over the years, with LGT, with all of the partners we have had, have been deep sharing of intellectual property and deep sharing of mutual desires. Johnson & Johnson have helped us digitally equip all of our community healthcare workers, which has been critical. But I think when we think about multi-stakeholder partnerships, we need to think about the fact that actually paying frontline healthcare workers is not groundbreaking. This is absolutely basic.
Completely.
And so we need to think about, and I was one of the people, bashing pans in the United Kingdom all the way through COVID, but we also pay healthcare workers. And so that was gratitude. We cannot be possibly in a situation where we're not adequately funding frontline healthcare workers. And so that's why we need to think collectively. How can we partner? How can we globally lobby institutions, financial architecture, so that this funding is prioritised, it's available, and it's critically accessible to frontline healthcare workers and those on the ground? And so that kind of partnering for impact means that we need clarity on the role of each and every one of us within the ecosystem. What are the roles of government, of local implementers, of civil society, of NGOs, of the corporate sector to innovate, to research, and to really create social change? Because no actor can drive growth in a country like a flourishing private sector. And so when we think about multi-stakeholder partnerships, we absolutely need to think about that. And so as we think about some of those successful relationships, I think about the relationship between Save the Children and GSK. They've reached tens of millions of children through that partnership. The relationship we've had with Johnson & Johnson has done the same. And so I think we think about beyond funding. How do we beyond fund to joint objectives? Because we know there's a $4 billion financing gap for community healthcare workers. We know that 600 million people across the continent can't access healthcare. What are we going to do about it?
Great question. And I'm actually going to turn back to you because you talked about some key ingredients there as well, shared values. And too often it's easy to say, we're in it for the right reasons. And how do you go and take challenging partnerships and make sure you go deep? And it's not just a promotional collaboration. And you were touching on that partnerships don't just have to be a monetary exchange. But share with us a little bit about some challenges you've seen and how to really make sure that partnerships work for that shared value.
This probably sounds patently obvious, but we're partnering with humans. And so actually, whatever our relationships, whether they're bilateral, multilateral, whether they're with philanthropists, whether they're with the private sector, whether they're with other implementing partners, we are working with humans, and we need to bother to get to know what those humans want and desire from the relationships. What are the big dreams? You know, as an organisation, we want to reduce preventable death by a third. We want to do what we started and set out to do 20 years ago and eliminate paediatric AIDS and end AIDS. We're not going to do that on our own. And so who is prepared to sit and dream really, really big with us and then move those dreams to action? And that's where the multi-stakeholder partnerships come in. That's where a deep analysis of organizational, governmental, commercial goals, and actually understanding what's in the middle of the Venn diagram. Where is the intersectionality? Where is the bit that we're all actually dreaming about, and how do we make it happen? Because if we all sit in our respective vantage points and think about our own organizational goals, then we have a deeply fragmented approach to actually solving the world's biggest problems. And so whenever you start any relationship, it's actually thinking about, if we can do what we really want to do, if we want to achieve what we really want to achieve, how do we honestly set about doing that? And how do we leave some of the sacred cows and all of the things that we all have as organizations and actually remember what the real goal is? And the real goal is professionalized community healthcare workers who are being paid to deliver high-quality primary healthcare services.
Thank you, Emma. Wow. That's a lot of wisdom there, and especially after, for many of us, getting to reconnect in person. We are people that are motivated by our hearts to these causes, and to find that common interest is key to really addressing challenging partnerships. But you know, another theme that's really surfaced on today's panel is about the role of having partnerships across sectors, and really the public-private partnership is one we've heard, but we've also heard about private partnerships with NGOs and civil society. And on that note, I'm delighted to be introducing Lauren Moore, the Vice President of Global Community at Johnson & Johnson. The Johnson & Johnson Foundation, alongside with Skoll Foundation, is supporting a very exciting global fund, Africa Frontline First Catalytic Fund. I'm going to repeat that. I'm sure you've heard about it a bit today, but we will hear directly from Lauren Moore about the Global Fund's Africa Frontline First Catalytic Fund. Lauren, if you could share with us, how will this direct investments into community health in Africa, and can you tell us why this cross-sector partnership is particularly critical at this point in time?
Well, thank you so much, Roopa, and thank you for the conversation. I have to start by just saying I have a lot of humility joining the panel with the esteemed experts and the minister. Thank you for having me, but also hearing from the health workers on the panel before us, because I think sort of first and foremost, making sure that the folks who are doing the work on the front line are part of any of these conversations and solutions, who sort of have the real story and know the real work. And so I'm happy to share a perspective today, but just want to certainly acknowledge that contribution. The Africa Frontline First Fund, I think there's a number of reasons. You know, Johnson & Johnson, to your point, Emma, and others, has always believed in partnership, in part because if you want sustainable change, you're not going to do it by yourself. And so the idea that you do partner with governments to make sure that the public sector is there, as well as other players. And I think there's a long history of private sector investments being done a bit one-off and not necessarily as partners. And so I think the critical nature of sustainable change being driven by partners who have the same goals in mind is hugely important. For the Africa Frontline First Fund, it's been a really interesting conversation, because I think we do see with the Global Fund bringing this group together, having a key stakeholder who can bring folks to the table who have some expertise, especially when we've got some shared areas for that commitment. It's to increase 200,000 health workers, 10 countries across Africa, And just the idea that you can look at some key attributes of things that seem to be working and look to potentially scale. I think our premise at Johnson & Johnson for our Center for Health Worker Innovation, which we announced in 2019, 2020, a focus on frontline health workers, is that with 50% of the people in the world without access to primary care, that to create that access to primary care is likely going to happen through a nurse, community health worker, or midwife, and whatever we can do to support those populations who are really sort of the humans at the heart of care, by paying them, by supporting them. I love the conversation today about the fact that they're human and they have the same needs that everyone else has. I like calling them heroes, but it almost separates them from the normal sort of mental health and resilience that we all need, especially in times like the pandemic. So in any case, the idea that frontline health workers are an answer to sustainable health systems and whatever we can do. The other piece I think the private sector can play sometimes is using our voice on behalf of health workers. And so you might see that we also try to not do campaigns or media around our role, but around the role of the health worker, and make sure those voices really are heard, especially in areas where they might not have been heard before. And so our commitment to AFF is really about coming to the table. To your point, Emma, we believe in getting involved. Some people do only want the funding. We tend to say we really want to bring everything to the table. People expect all of the expertise and all of the employees, and sort of however we can use our assets, including the money, but not only the money, to really try to drive sustainable change. And so I think the idea that we can join some of these coalitions has been an incredibly powerful way to operate. And then, of course, the longer term partnerships. I think we've partnered with everyone here. And the idea that you stick with something, nothing happens quickly. And so the idea that you try to look together at the things that you really want to pursue, and then take the time, get to know each other, spend the time on the ground with the experts, i.e. the community health workers, the nurses, the midwives, to make sure that those voices are at the table as you try to look sort of at the future. So very appreciative of the conversation today, and thanks for having me.
Thanks, Lauren. And I just want to follow up and emphasize one area particularly. There's so much momentum. I mean, it's so great to come back to this, city after 2 years for this Onyango week, and it's nice to, not be just talking about the problems or saying how do we get the attention of our policymakers, how do we get the attention of even the multilaterals like Global Fund on this issue. So can you tell us why this particular fund is so critical now, as being one of the founding partners on this?
Yeah, I do think the particular collaboration and the Global Fund and the role that they're able to play to bring stakeholders to the table is quite important. And so I think being able to have the grassroots up, but sometimes the top down, and making sure that the key leaders and stakeholders are paying attention. I think in several of the conversations where I've now been talking about AFF, the Africa Frontline First investment, I think it gets people's attention, and sometimes that's part of what you need to drive. And so the idea that it's long-term, it's going to be choosing 10 countries in Africa to start, the possibility with those partners of real scale and real sustainable change again, and how you can help drive those areas. I think we've got global leaders who are paying more attention, and especially when you want to shine the light on the fact that we see frontline health workers as the answer to UHC, to sustainable change. When we heard about in the panel before this, if you help the health worker, you improve health for everyone. And so the idea that as much as we can sort of drive that consistent viewpoint and attention to the frontline health worker, I think is really an area to see sustainable change.
Thank you, Lauren. I fully agree. And this pandemic has reminded that we must turn this applause into action, and we're glad to see this type of catalytic fund. We are at time, but I'm going to give an opportunity to all of our panelists to leave us with some final words of wisdom. I have a unique question for our Honorable Minister. And this is really, we're hearing a lot about the Global Fund this week. We're very excited about the goals that they have set. We are hoping they will achieve their replenishment goals, especially as they have committed to having a more sustainable health workforces and strengthening health systems. So how does Tanzania plan to engage? Not a problem. But how does Tanzania plan to engage with Global Fund and use its investments, particularly with community health workers? How do you plan to take advantage of this opportunity?
Thank you very much, Roopa. Of course, Global Fund has been actually a major contributor in our fight against tuberculosis, HIV, and malaria, including strengthening health systems in Tanzania. And they have been supported us also to improve or to absorb community health workers, as well as skilled healthcare workers. So the future, actually, we are planning to focus more on community health workers. And to me, as a minister responsible for health, as a woman, as a mother, strengthening community health workers is not only about achieving universal health coverage, but empowering women. In Tanzania, 90% of community health workers are women. So we are going to achieve our intended better health outcomes, but we are also going to empower women who are working as community health workers. However, I need to confess, I have a challenge in Tanzania. As I said, we have quite a big number of skilled healthcare workers actually in the labor market. 2 years ago, I was challenged, Minister Ummy, why do you want now to formalize community health workers? Well, you have doctors, nurses, and other clinicians actually on the street. But my position and the position of the Minister of Health, we need both. Facility-based skilled workers as well as community-based workers. So we are going to combine both. We look forward to work with the Global Fund because by investing on strengthening our community-based intervention, we do believe that we'll be able to achieve our UHC targets, but also empowering women who work as community health workers, including young girls in Tanzania. Thank you very much.
Thank you, Honorable Minister. And now the lightning round for our panelists. We've heard so much. I am not going to try to summarize because I think there's a lot of lessons here. The take-home message is partnerships can work. Partnerships are needed to go ahead and sustain. And really, we need partnerships to take action. And we've learned all sorts of lessons of what partnerships look at the global level, at the national, the subnational. So I'm going to ask each one of my panelists to say, what is one thing that you would say as a takeaway that you would do differently when it comes to partnerships to sustain them for the impact we're hoping to achieve for community health workers and all health workers today? So I'll first turn to Thomas and Emma and then Lauren to close us out.
Yeah. Oh, sorry. Yeah, sorry. I think I was thinking many, but I'm just trying to think of one. Okay, but one of them I think is really just authenticity. Yeah, I think that's a big word around it. If we can craft them around very authentic values across different stakeholders, and then it becomes easy to sustain. Because without that, I think partnerships are a bit difficult to manage. So how do you work through it, through the journey, hold each other accountable, and ensure that they're working for the common good, which is really the community health worker in the community. Thanks.
And make great pudding, too.
Thank you.
Emma, please.
Firstly, I want to help the Minister with the conundrum she was posed. We can point you to research that shows that community healthcare workers and peer community healthcare workers specifically often have better health outcomes than clinicians, and so that might be one thing. That might be one thing to share, and that we are not going to reach 600 million people additionally who don't have access to services without creating whole new cadres of healthcare workers. So. There's nothing like peer-reviewed articles to be not contested. But in terms of what we really need to do, if we want to be the generation that delivers health for all, it's down to one word. We need to scale, scale, scale. We are not going to achieve the outcomes we need for women, for girls, for families, for the next generation. We're not going to close the demographic dividend if we don't scale. And so we are going to have to be brave and audacious in the partnerships we create. We're going to have to work together properly and nicely and honestly and scale.
Thank you, Emma. And I have to say, as a fellow clinician, the common interest is that we are trying to achieve universal health coverage. We're trying to care for our communities, and every health worker will show up for that. So on that note, I turn to Lauren to close us out.
Yeah, I was thinking about some early partnerships we have in Kenya, actually, and the way they were kicked off was to bring all the different stakeholders to the table for some workshops to make sure everyone was very clear about why they were there, from the health workers and the nurses to the government, the private sector, the NGO sector, with real conversation over a couple of hard days and then, of course, weeks and further. So the idea that everybody had a voice at the table, we really understood why people were there, the clarity of purpose and what people were getting out of the partnership, and then some milestones to know that we were making progress. And so I think this idea of sort of workshopping it when that doesn't always happen on the front end has meant that we've had some successful early work there that I don't think would have happened otherwise.
Thank you, Lauren. Well, as we come to a close, I want to say again a very special thanks to our Honorable Minister, our panelists, for being candid with us, talking about their partnership experience. But this is the time. The momentum is happening, and we're here to make it happen. So I encourage all of you to take what we've discussed throughout the day. While this is the last panel, the conversation is not yet over. Let's continue to use today and really the health workers, which are the heartbeat of all of our health systems. It's time to invest in them, to take action and give them the decent jobs who are majority women, so make sure they're gender equal jobs, recognize